So in terms of urine analysis, basically it's one of the very common tests we do to check for the health problem. For example, we check for the presence of glucose and presence of the ketones, which indicate a person that whether he or she may have this diabetic mellitus or not. Again, diabetes. Okay, if a blood glucose concentration increases above, we talk about this renal threshold, means that when it's above the renal threshold, not all glucose will reabsorb back and the glucose present in the urine, and this may be the indication of the diabetes. Okay. And we do know that most proteins are too large to be filtered. Some proteins are small proteins, may be able to filter into the Bowman capsule, but the endocytosis just now at the PCT, okay, and also will take place. Endocytosis, okay, in the PCT broken down, and the amino acid will reabsorb back into the blood. Okay, some proteins are present in the urine for a short period of time. For example, high fever. When you have vigorous exercise and during pregnancy, yeah, you may see the some protein, okay? But large quantity or long-term presence of the protein may be an indication for the glomerular inflammation, or maybe kidney infection, or may due to the kidney failure. So where dialysis may need to take place, okay? So protein urine also associated with the high blood pressure. Now, what high blood pressure? When you say high blood pressure, basically means that the pressure in the glomerulus is very high. So until it forces out the protein, okay? And we do know that high blood pressure is also a risk factor in the heart disease, okay? So this is what we say, that we need to do the urine analysis to check for these few items. First item, always the glucose and the ketones. Second, we check for the presence of the protein, okay? And if for the glucose, then we need to go through this, what we call the renal threshold. Okay, so sometimes we check, oh, it's normal, no trace of glucose, but it doesn't mean that person's body system works well. Why? Because it might be because of the renal threshold. So for example, renal threshold is 180, but our body, let's say for a person, the body glucose level is 170, but normal is only 120. Can you see that? So it means that the person actually do have the problem, but we can't detect it through the urine. But if you see glucose in the urine, then definitely the person actually already have problem. Okay, so diabetes mellitus most likely. Okay, so with this, I have done for the lessons now. So